Here's my audience. First, I'd like to thank my audience for being here today. My speech today I'll be presenting will be informing you about the symptoms, causes, diagnosis, and treatment for ulcerative colitis. Imagine having to get a colonoscopy at the age of 19, which also requires drinking a terrible liquid. Today, I'll be talking about ulcerative colitis. Ulcerative colitis is an inflammatory bowel disease, or IBD for short, that causes long-lasting inflammation and ulcers or sores in your digestive tract. UC affects the innermost living of your colon and rectum. It was first described in 1875 by two English physicians, Wilkes and Moxon, who distinguished it from diarrheal diseases caused by infectious agents. On October 11, 2019, when I was a sophomore in college, I was diagnosed with ulcerative colitis alongside my primary sclerosing cholangitis. In North America, UC affects approximately 40 to 240 in 100,000 people. It is estimated that more than 750,000 North Americans are affected by this disorder. Since some of you may not be aware of ulcerative colitis or know it exists, it is important for you to know its symptoms, causes, diagnosis, and treatment for it. Some common symptoms are diarrhea, often with blood or pus, abdominal pain and cramping, rectal pain and rectal bleeding, urgency to defecate, inability to defecate despite urgency, weight loss, fatigue, fever, and in some children, the failure to grow. Cause, as stated by Mayo Clinic, remains unknown. One possible cause is an immune system malfunction. Hereditary also shows that this could be a cause, but however, most people with ulcerative colitis do not have this with family history. The diagnosis. To help confirm a diagnosis, you may have one or more of these following tests and procedures: a blood test, a stool sample, a colonoscopy, a flexible sigmoidoscopy, an X-ray, or a CT scan, also known as CAT scan. Treatment usually involves drug therapy or surgery, corticosteroids like prednisone, immunomodulator drugs, biologics like Humira, the TV commercial you've probably seen. Surgery can often eliminate ulcerative colitis, but it means removing your entire colon and rectum by a proctocolectomy. In conclusion, we have went over the symptoms, causes, diagnosis, and treatment of ulcerative colitis. If you are feeling fatigue a lot and are having severe weight loss due to defecating, you may have ulcerative colitis.